Welcome to the deep dive. Today we're going a bit deeper than maybe the usual ear gunk. We're looking at inflammation of the middle and inner ear in dogs and cats.
Otitis Media and Otitis Interna, as it's known technically.
Right. And it's important, isn't it? Because while most pet owners know about, standard ear infections.
Exactly. These are a step beyond that. They can be quite a bit more serious with potentially wider impacts. Understanding them is key to getting help quickly.
We've been digging into a veterinary reference guide, sort of pulling out the core information for you.
Yeah, our mission, if you like, is to break down what these conditions are, what signs to look for, the causes, and importantly, the potential complications.
So we want to give you that clearer picture of these more involved ear problems. Okay, so let's start right there. What exactly are otitis media and interna?
Okay, so simply put, otitis media means the middle part of the ear is inflamed.
Right.
And otitis interna is inflammation of the inner part. The really common thread often is a bacterial infection kicking things off.
Okay, bacterial infection. And how does it get in there to those deeper parts? What's the route?
Well, for otitis media, a very common way is it starts as an outer ear infection, otitis externa.
The kind most people are familiar with.
Precisely. And that infection basically pushes through a ruptured eardrum.
Ah, okay.
Another pathway, though, is from the mouth or the nasal passages. Bacteria can travel up through the eustachian tube.
Right, that tube connecting the throat and the middle ear.
Exactly. Straight into the middle ear.
So something seemingly minor on the outside or even in the throat could actually seed a bigger problem deeper in.
That's a really good way to put it, yeah.
What about otitis interna, the inner ear? Is it the same process?
It can be, yes. Yeah, it might just be a direct extension from the middle ear. So media leads to interna.
Okay.
But interestingly, otitis interna can also happen if there's a systemic infection, something circulating in the blood.
Like a body-wide infection.
Yeah. And that infection finds its way to the inner ear via the bloodstream. It really shows how, everything's connected.
It certainly does. A good reminder. Now, you mentioned wider impacts. These aren't just ear problems in isolation, are they? The source talks about other systems being affected.
No, absolutely. The nervous system is the big one.
Okay.
You see, the inner ear houses the vestibular apparatus. Think of it as the body's balance center.
Like an internal gyroscope.
Pretty much, yeah. So if that gets damaged, or the nerve connected to it, the vestibular part of the vestibulocochlear nerve gets inflamed.
Then balance goes haywire.
Exactly. You get impaired balance, dizziness, and just like us, when pets feel dizzy, they often feel nauseous.
Right, makes sense.
Plus, the inner ear also contains the cochlea. That's the hearing part.
Ah.
So damage there, or to the cochlear part of that same nerve, can lead straight to hearing loss, sometimes profound hearing loss.
Wow. So balance, hearing, fundamental senses directly hit. That sounds, well, pretty serious. And the eyes, too. That seems less obvious.
It does, but yeah, the eyes can show signs. If the facial nerve gets damaged as it passes near the middle ear,
Okay.
it can affect blinking. The animal might not be able to blink properly on that side.
Which could lead to problems on the eye surface.
Definitely. It can cause a corneal ulcer, basically a sore on the cornea, and that same facial nerve helps control tear production.
Ah, so dry eye.
Exactly. Keratoconjunctivitis sicca, or KCS, dry eye. And then there's Horner's syndrome, which is quite fascinating.
Tell me about that.
This happens if the sympathetic nerve supply, which also runs through the middle ear area, gets damaged.
Okay.
It results in a collection of signs, all on the same side as the bad ear. The pupil gets smaller. The third eyelid might pop out more.
That little membrane in the corner of the eye?
That's the one. Also, the eye might look a bit sunken in, and the upper eyelid can droop down.
Wow, that's a whole cluster of signs just from nerve damage in the ear.
It is. It really highlights those connections, doesn't it? Damage in that small space having such noticeable effects elsewhere.
Absolutely. It hammers home that this is more complex than just a simple earache.
Okay, so are certain pets more likely to get this? Are there predispositions?
There are. I mean, dogs and cats both get it. But yeah, certain dog breeds seem more prone.
Like who?
Cocker spaniels are often mentioned, along with other breeds with those long, heavy, pendulous ears.
Because the ear canal doesn't get much hair.
That's the thinking, yeah. It might create a more humid environment, better for infections to take hold, which can then progress inwards. Also, poodles, especially if they have chronic outer ear infections, or even things like throat infections linked to dental disease.
Ah, the dental link again.
Mm-hmm. And Cavalier King Charles Spaniels have a specific condition called primary secretory otitis media, PSOM.
PSOM.
Yeah, where basically this really thick mucus plug forms in the middle ear. It's not really an infection initially, more of a plumbing problem almost.
Interesting. So anatomy, chronic issues, even dental health can play a role. What about age?
It can happen at pretty much any age. It's not strictly an old dog or young puppy problem. Okay, so always something to keep in mind. Now, the crucial part for owners. What signs should make you think, maybe this is more than just a dirty ear? What are the historical or physical clues?
Right, this is so important. And the signs can really range, from almost nothing obvious to quite dramatic neurological signs, depending on severity.
Okay.
Looking back, an owner might recall the pet seemed painful when opening its mouth, maybe reluctant to chew hard food.
Like it hurts their jaw or head.
Exactly.
Yeah.
Or more head shaking than usual, maybe pawing persistently at that ear. Those suggest deeper discomfort.
And what about the balance issues we talked about? How would an owner see that?
If it's just one side affected, the classic sign is a head tilt towards that side.
Okay.
They might also lean or drift or even fall towards that same side. Some might even roll.
Roll over completely.
Yes, it can happen, especially if it's sudden. If both ears are affected, which is less common but possible.
Then it's different.
Yeah, you might see wide, swaying head movements, like they're trying to figure out which way is up. Their walk can be very uncoordinated, sort of staggering gait. And these signs, they can be constant, or they might just come and go.
So even a brief episode of wobbliness shouldn't be ignored.
Definitely not. It warrants checking out.
Okay, those balance signs are pretty clear red flags.
Yeah.
Any other maybe more subtle things?
Well, especially early on, vomiting or signs of nausea can occur because of dizziness.
Right.
You might notice drooling or perhaps food falling out of one side of the mouth when they eat, and keeping an eye on the eyes, like we discussed. Inability to blink, any unusual discharge.
And the Horner's signs.
And the Horner's, yes.
Yeah.
That smaller pupil, the prominent third eyelid, the sunken look, the droopy eyelid, all on one side.
It's quite a list of possibilities.
Yeah.
And what about during a vet check? What might the vet pick up on during the physical exam?
So the vet will obviously look for signs of the outer ear infection, redness, discharge, narrowing of the canal. That's often the starting point. But the key finding suggesting middle ear trouble is the eardrum itself. Using an otoscope, they might see it looks dull, maybe gray or opaque instead of translucent, or it might even be bulging outwards.
Indicating fluid behind it?
Precisely. Fluid or pus building up in the middle ear. They'll also check for dental disease, feel for swollen lymph nodes under the jaw, see if there's pain on opening the mouth, or pressing gently near the base of the ear.
And check the eyes for ulcers or dryness.
Absolutely. Check corneal health and tear production.
We touched on neurological signs, but in a specific neuro exam, what else might a vet find?
They'll formalize those observations.
Yeah.
So with unilateral vestibular disease, one side affected, they'll confirm that head tilt is towards the lesion. They'll test balance reactions, confirming the leaning or falling to that side, and they'll look closely at eye movements, specifically nystagmus.
Those rapid flickering eye movements.
Yes. Usually the fast phase beats away from the side with the problem in peripheral vestibular disease, which this usually is.
And if both sides are affected, bilateral.
Then the animal might be really reluctant to move at all, often stays crouched low. Those wide head excursions are typical, and their normal stabilizing eye movements when the head turns, those might be reduced or absent.
Okay. And the facial nerve signs, how are those assessed?
The vet will test facial sensation and motor function check for drooping of the ear, lip, eyelid on one side, test the blink reflex, look at nostril movement, check tear production, maybe with a special test strip.
And you mentioned it can become chronic.
Yes, long-term paralysis can sometimes lead to contracture, a tightening of the facial muscles on that side. And yeah, sometimes both sides can be affected.
And lastly, confirming Horner's.
Confirming those signs. The small pupil meiosis is the most consistent finding. Then looking for the raised third eyelid, the sunken eye, ophthalmos, and the droopy upper eyelid, dystosis. And remembering that can be linked to PSOM in Cavaliers specifically.
Got it. A very thorough exam is clearly needed. Let's shift to the why. What actually causes otitis media and interna? What are the culprits?
Well, top of the list is bacteria. The usual suspects are often involved staph, strep.
Like in-skin or outer ear infections.
Often, yes. Also things like Proteus, Pseudomonas, Pastorella, E. coli, and don't forget anaerobic bacteria, the ones that don't need oxygen.
Okay, lots of potential bacteria. What else?
Yeasts and fungi can play a role too. Malassezia is a common yeast found in ears. Candida, Aspergillus fungi. less common causes, but possible,
Right?
and ear mites. Well, they don't directly invade the middle ear, the intense irritation and inflammation they cause in the outer ear.
Can pave the way for bacteria.
Absolutely. They really predispose the ear to secondary bacterial infections that can then move deeper.
Are there non-infectious causes too?
Yes, definitely. Foreign bodies are a big one, especially things like grass awns or seeds. They can migrate right down the canal.
Ouch.
Trauma to the head is another possibility. And growths, things like polyps, which are benign inflammatory growths, often seen in cats starting from the middle ear or eustachian tube, or actual tumors, benign or malignant like fibromas or various carcinomas.
So growths can block things up or cause inflammation directly.
Right. And one more cause, unfortunately, is injury during, say, an overly aggressive ear cleaning or even during an exam, if not done carefully. Iatrogenic injury, we call it.
Okay, quite a range of potential triggers. This leads nicely into risk factors. What makes an animal more likely to develop these conditions?
Number one is probably having recurrent otitis externa, those outer ear infections that keep coming back or aren't fully cleared up.
Because the infection just gets a chance to move deeper over time.
Exactly. Also, having polyps or tumors in the ear canal or even the nasal passages, as they could obstruct drainage and ventilation.
Makes sense.
In cats, there seems to be a stronger link with upper respiratory infections, probably via that eustachian tube again. And for all pets, dental disease is a definite risk factor.
That connection keeps popping up.
It's important. Also, things like aggressive ear flushing, especially if the eardrum might be ruptured.
You could push debris in.
You could. And using certain cleaning solutions, particularly some containing antiseptics like chlorhexidine, if the eardrum isn't intact, they can be quite irritating, even toxic, to the middle and inner ear structures.
So good intentions gone wrong if you don't know the eardrum status. Okay. Diagnosis then. How does the vet figure this out for sure, given that some signs overlap with other issues?
Yeah, that's the challenge, ruling out the differential diagnoses.
What kind of things mimic these signs?
Well, you've got congenital vestibular problems born with it. Hypothyroidism can sometimes cause nerve issues, brain tumors or inflammation elsewhere in the head. Idiopathic conditions, meaning cause unknown, like idiopathic vestibular disease, often called old dog vestibular disease, though it could affect cats too.
Right, that sudden onset dizziness.
Exactly. Also idiopathic facial paralysis, other infections like fungal diseases, say cryptococcus, head trauma, thiamine deficiency in cats can cause vestibular signs, certain drug toxicities, and crucially, problems actually in the brainstem or cerebellum central vestibular disease rather than the ear itself.
So the vet has to be a bit of a detective.
Absolutely. It's about piecing together the history, the exam findings, and sometimes specific tests.
What about lab tests? Blood work?
It can help. Blood counts might show signs of infection, like high white blood cells, maybe what's called a left shift. Chronically, globulin protein levels might be up.
Okay.
If a blood-borne spread is suspected, blood or urine cultures might be done. And thyroid testing, if hypothyroidism seems possible.
And imaging. How useful is that?
Very useful, often essential. Video otoscopy is great, using that small camera to really magnify the view of the ear canal and eardrum.
See if it's ruptured. See fluid behind it.
Exactly. And allows for sample collection, too. Standard skull x-rays, focusing on the bony bubbles housing the middle ear, are less sensitive, but might show thickening or bone destruction in chronic cases.
For more detail.
CT, or MRI, are the gold standard. CT is generally better for looking at the bone itself and fluid in the middle ear. MRI gives superior detail of the soft tissues, including the inner ear structures and, importantly, the brain. That's crucial if central disease is suspected.
So imaging choice depends a bit on what you suspect most.
Pretty much, yes.
Are there other specific procedures, like getting a sample from the middle ear?
Yes. That's called myringotomy. It involves making a tiny, careful puncture in the eardrum with a needle to aspirate fluid from the middle ear space.
And that fluid can be tested.
Exactly. Sent for cytology, looking at the cells under a microscope, and for culture, to identify the specific bug and what antibiotics will kill it.
What about hearing tests?
A BAE test brainstem auditory evoked response can objectively assess the hearing pathways. Useful if hearing loss is suspected.
And if brain involvement is a big concern.
That a CSF tap collecting cerebrospinal fluid from around the spinal cord or brain might be recommended to look for inflammation there.
And if it gets to surgery and tissue is removed, what does the pathology usually show?
Typically, you'd find purulent material, pus, within the middle ear cavity. The bony bulla might be thickened from chronic inflammation. Microscopically, you see loads of inflammatory cells, especially neutrophils, often degenerate ones, and usually bacteria can be seen as well.
Okay, so putting it all together leads to the diagnosis. What about treatment? How is otitis media or internity managed?
It really depends on the severity. Pets showing significant neurological signs, like severe balance issues or disorientation, often need hospitalization for initial stabilization and treatment.
Makes sense.
Milder cases might be managed as outpatients. Nursing care is key fluids if they're dehydrated, careful cleaning of the outer ear, using just saline if the drum is ruptured.
Right, avoiding those irritant cleaners.
Definitely. And restricting activity for pets with bad balance to prevent falls. Careful feeding if they're nauseous or dysphagic to avoid aspiration.
And what should owners be prepared for treatment-wise?
They need to understand it's often a long haul, especially with antibiotics. Most bacterial cases do respond to appropriate antibiotics, but they need to be given for a long time. Think 6 to 8 weeks, sometimes longer.
Wow, that is a long course.
It is, but it's crucial to fully eradicate the infection and prevent relapse. Owners should know relapse is possible, and sometimes surgery might eventually be needed if medical management doesn't fully resolve it, especially if there's persistent fluid or bone involvement.
Is surgery decided just based on the neurological signs?
Not necessarily. Surgery, like a bull osteotomy to drain the middle ear, is more often considered if there's fluid that won't clear with meds, evidence of bone infection, osteomyelitis not responding, or if there are polyps or tumors that need removing.
And sometimes the whole ear canal needs removing.
Yes, a total ear canal ablation combined with bulla osteotomy, TECABO, is a major surgery, usually reserved for cases where the middle ear disease is driven by irreversible end-stage outer ear disease or tumors in the canal. And yes, tissue samples are always taken during surgery.
Let's talk meds. What's typically used?
Topically, again, if the drum is ruptured, only safe options like water, saline, or Trizeto-based cleaners. Then specific antibiotic or antifungal drops based on what's found. Systemically, those long courses of antibiotics are key.
Which ones?
Ideally based on culture and sensitivity results. But often, you start with a broad-spectrum drug while waiting for results. Amoxicillin clavulanate is a common first choice.
Okay.
If that fails, or culture points elsewhere, maybe a fluoroquinolone or a third-generation cephalosporin, clindamycin is good if anaerobic bacteria are strongly suspected.
And for the nausea?
Anti-nausea meds, like meclizine, which is actually an antihistamine, often used for motion sickness, or more potent ones like meropitant or ondansetron, can really help manage the vomiting and discomfort from the vestibular signs.
Are there things absolutely to avoid? Meds or treatments?
Yes, big ones.
Yeah.
Avoid any potentially ototoxic ear cleaners and medications if the eardrum is ruptured or even suspected to be. Aminoglycoside antibiotics, for example, given topically, can damage the inner ear.
Okay, crucial point.
And use corticosteroids, like prednisone, very cautiously. While they reduce inflammation, they can also suppress the immune response and potentially worsen an active infection. They have a place sometimes, maybe to reduce swelling, pressing on nerves, but carefully. And no vigorous flushing.
Gentle cleaning only. Got it. How soon should pets be rechecked?
Usually within 1 to 2 weeks of starting treatment, just to see how things are progressing. Sooner if they seem to be getting worse, of course. Follow-up is really important.
And prevention. Anything owners can do.
Good parasite control is basic, but important, especially for ear mites. Promptly and thoroughly treating any outer ear infections is key to stopping them from progressing inwards.
Makes sense. What about long-term issues? Even after treatment, can there be lingering problems or complications?
Unfortunately, yes. Sometimes, despite treatment, a head tilt might persist. Some degree of facial nerve paralysis might be permanent. Horner's syndrome can sometimes linger. A serious complication is the infection spreading inwards to the brainstem, causing central neurological signs. Bone infection of the surrounding skull bones can happen. And post-surgery, complications like Horner's, facial nerve damage, worsening balance problems, or even deafness are possible risks of procedures like bulla osteotomy.
So it's not always a perfectly smooth recovery, even if the infection clears. What's the general outlook, the prognosis?
Generally, it's considered fair to good for most cases if they receive appropriate long-term medical management. Those long antibiotic courses are key to preventing relapse.
And the dizziness and balance issues?
Those vestibular signs usually improve significantly over, say, 2 to 6 weeks, although some residual head tilt might remain in some cases. The prognosis becomes more guarded if there's severe, chronic underlying outer ear disease that can't be controlled medically, or if complications like brainstem involvement occur.
This has been incredibly informative, a really thorough deep dive. So just to kind of wrap up the main points, otitis media and interna are definitely more serious than the average ear infection,
Hmm. Much more.
affecting middle and inner ear structures, impacting balance, hearing, facial nerves, a whole range of things.
Right. And recognizing those signs, even the subtle ones, and getting prompt veterinary care is just crucial.
Absolutely. That early intervention seems key.
It really is. And, thinking about all these connections, the ear, the nerves, the eyes, even the throat and teeth, and the variety of symptoms, it does make you think, doesn't it?
How so?
Well, it makes you wonder, what subtle changes in your own pet's behavior? Maybe a slight head tilt you dismissed, or maybe they seem a tiny bit clumsier, might actually warrant a second look, specifically thinking about their ears.
That's a really good point, to be more observant of those small things.
Exactly. And if your pet did have ear issues now, knowing all this, what different questions might you ask your vet? What would you want to make sure gets checked or discussed? Makes you approach it differently, perhaps.